here at the National Nursing Forum in Hobart, and it looks a little bit like we're in a nightclub at the moment, but I'm here speaking with one of our early keynote speakers. Georgina, could you introduce yourself, please?
Hi, I'm Georgina Willetts. I'm a registered nurse and a registered midwife. I've been nursing for 38 years. I started in the old hospital training system and then went on to transition into postgraduate qualifications. And now I've ended up as the head of nursing at Swinburne University. Not that I ever thought that I would end up in a university and as an academic, but I have.
I thought that was quite fun. You said you went into nursing because you didn't want to go to uni, and
Yes.
there you are.
Yes, no, who would have thought?
Which is about the nature of the transition of nursing over these years, isn't it?
I think so, yes. And I mean, there's still a lot of, a lot of people feel that the old ways were better, that we learned the skills, but we didn't learn the critical thinking. We didn't learn the theory of nursing. And I certainly don't think it was better. I was efficient at the skills, but I don't think that I really understood what I was doing or had the critical thinking or the clinical reasoning behind me when I was, back in those days. And that's something that's taken a while to develop and to fully understand, my nursing practice. So we need to give time and space for undergraduates now to learn that.
So you talked, your keynote was about the future of nursing, really, the development of nursing,
Yes,
and trying to get a better foothold in policy making, and really the role of nursing in health policy. What are the issues there? What did you want to get across today?
Well, I think the thing is that because of the intangible nature of nursing and because we are sort of tarred with this brush that it's a natural vocation, you were born to be a carer, it's, that we do the soft skills. It's we sort of lose our way. People don't recognise what we do, don't recognise the significance of what we do. We don't voice what we do because of the nature of caring. So we, as I said in the speech, we are also a product of our society. So, we fit into that culture and so we don't voice it. But my experience is that learning to care, learning to do those intangible tasks, learning to do what I call the body work took years. Took years to really develop and took years of expertise and understanding the theory to really master that. And I think there's a turn in culture around this and an understanding. And I think this is the future that, the hashtag We Care is an important movement. And I think society wants that now. And for nursing, we need to develop that. We need to have our voices heard. We need to let people know that those soft skills are really, really hard to develop. The technical skills are the easy part. It's the other things that we do in nursing, the caring, the therapeutic relationships, those sort of things that have traditionally been, invisible are complex and they can be taught. I certainly wasn't a born nurse.
How did that manifest, not being a born nurse?
Well, I think that I was part of my society, and in those days, I didn't do so well in my leaving, and so my family thought it might be a good idea if I went nursing, might give me another option. There'd be more opportunities for me to, end up in a higher place in nursing if I married the right sort of person. So there was all that went into that way of thinking. So, I was part of that society. I was always a bit of a nonconformist, so that didn't sort of fit with me. I think, as I said in my speech, the schooling that I had in nursing was quite forward and it was on the cusp of professionalisation. And there were some real nurse leaders like Professor Christine Duffield who were there and who influenced me. I was, a young teenager who was able to be influenced and, I was passionate about doing something. And I think the raw experiences that you had on the wards with people and with people in such difficult and stressful situations was a real eye-opener and made me question a lot of my values. And I was young and in some ways probably too young and had led a pretty sheltered life. So I think that I've become very passionate about that, and that the ability to care is also, something that's very worthwhile. So when I say I wasn't born to be a nurse, certainly caring is something that I've carried on throughout my life, and probably did maybe as a child too, but I wouldn't say that anybody doesn't.
Mm.
Yeah.
You talked in your address about bodywork,
Yes.
and it's not a concept I've heard before in the context. What were your points? And
So
what is it?
bodywork has been coined in the literature, and it's the work that we do as nurses. So when we look after people, we do a lot of very personal um, things to the body that probably no other profession does. And this is, I think, for me, probably where the trust, a patient gets their trust. We wash them and we clean people. If a patient's sick, we will clean that up. It's very personal, and usually as a patient, you're quite embarrassed about those sort of things. And it's very important as a nurse that you maintain that dignity. So that's the body work that I talk about. But while you do that body work, you're also assessing somebody. So it's not just a matter of, you know, cleaning somebody up or washing somebody and putting them out or feeding them. You're also assessing. So you're assessing what their skin looks like. You're assessing how they move. You're assessing how they talk with you. There's a whole lot of things that become quite intuitive as a nurse that we don't realise how expert we are with that. And with that, we make decisions then about how we are going to plan the care, how we're going to communicate that care to other professionals. So that's the concept of the body work, and we are intrinsically connected to that, and it is subjective. Every patient is different.
You talk, though, that it's a political and part of the policy problem too for nursing. There's this
Yes.
sense of bodywork in the broader community, among nurses themselves, but also, of course, in other health professions.
Well, it's
What's the
dirty
politics?
work, isn't it?
Mm.
Like it's not very attractive. It's not like and it's not necessarily saving lives and doing all the fancy stuff. So, although policy and developing a voice to advocate for those sort of for patients and for healthcare is something that we need to do. We need to not think that what we do is undervalued or um, not acknowledged. And so that's where we need to start to become involved in policy because we do know about patient care. Intrinsically, we know about it.
And how do you think? What are the ways forward on that?
Well, I think more representation in politics, more representation at policy development. It is the medical profession that is usually at the forefront, and yet nurses make up 60 to 65% of all healthcare workers. So why is our voice not there? And there's so many reasons for that. But I think the time has come now where we need to step forward, and we are big enough and we are strong enough to really have our voices heard. And I think that will be beneficial to all healthcare.
What do you think nurses bring to a table in policy and politics that other health professionals don't?
I think the understanding of the patient perspective, the understanding of the experiences, the lived experience of the patient. We have a lot of understanding in the assessment skills, in the management skills of the big picture. We work across all contexts and in many, many areas. Our focus is not just on curing disease, it's on that holistic focus, it's on strengths rather than deficits. So it's a much more holistic approach. The whole idea of health prevention, health promotion is very much something that nurses are very passionate about. So I think that that's something that nursing brings to the table.
Anything else you'd like to say?
No, but I think we need to be louder.
Thank you very much, Georgie.